CBT stands for Cognitive Behavioural Therapy, and it's a therapy that takes a present-day focus, so dealing with present-day distress and difficulties. Changing your feelings can be quite hard. So if I said to you, I don't know what emotion you're mainly feeling now, but let's have you feeling some pity, you might find it quite hard to change from one emotional state to another just because you feel you want to. So if people say to you, don't be anxious about that or snap out of your depression, it may not be always terribly easy to do that. So what CBT says is let's look at the other factors inside the person that contribute to how you're feeling. So CBT says how you're thinking, how you're behaving, and what's going on physiologically in your body will all contribute to how you're feeling. So it may be easier to change one of those more directly, more under your control, than it is to just change your feelings directly. So while I was coming on the escalator on the tube, I saw a man coming up towards me. So he was approaching me on the up escalator, and he bared his teeth in what could only be described as a kind of a snarl. And this was quite an interesting little episode. And I was thinking in terms of cognitive behavioural therapy while I was looking at this. If I thought this man was a threat to me and that his snarl was something to do with his malintentions toward me, I of course would feel pretty scared, and my behaviour might be to run down the escalator. However, if I were to consider the possibility that maybe he had something stuck at the back of his teeth that he was trying to dislodge, my fear would be unfounded, and I probably wouldn't feel the need to run down the escalator. So that's sort of it in a nutshell. What am I thinking? Because that will have an effect on my feeling. And maybe I should check out my thoughts, because my thoughts are only a theory. So I ended up with two theories as to what this guy might or might not have intended. If I'd only ever gone with my first theory, I would have arrived here today terribly kind of anxious. A man threatened me on the underground. Well, actually a man just showed his teeth on the underground. So how we are interpreting events in the external world will have quite a profound effect on how we feel. Of course, any therapy is going to pose the question, how has it come about that these thoughts come to mind first? And so, although CBT has a present-day focus, we will look at a client's history to see what might have encouraged them to assume that every man who bares their teeth has some unfortunate intent towards them. So although we deal in the present day, we would also look and see how have these present day kind of thoughts come to bear. The way we work is quite different from what might be thought of as sort of a psychoanalytic approach. So you won't find us inviting you to lie on a couch for years and years and stare out the window, but we will find you will find us offering you pen and paper exercises. So for instance, a very famous one is called a thought record diary. So if I was getting you to find out how often do you have these thoughts about being attacked on the underground, it might be useful to fill out a thought record diary. Actually, I have these thoughts every time I go onto the underground. And working with a client in session, we might kind of chase those thoughts a little further using something called Socratic questioning to discover what is the client thinking about themselves, perhaps vis-a-vis others, at a slightly less conscious level. So for instance, you might often have a hot thought, as we would call it, of I am vulnerable or I am at risk. And then we would work with the client to assess, does this person actually live in a really scary, dangerous world where people are constantly attacking him or her on the underground? Or does this not actually match the reality of her or his experience? So a thought record diary would be one example. We then might go on to conduct what we would call behavioural experiments, testing out these two hypotheses. You know, my theory is that every time I go onto the tube, a man attacks me. My therapist's theory is that I have unwarranted anxiety about this. And so we might get the clients to check out their anxious predictions. So it's a very active therapy, both in session and out.